Can weight loss medication cause emotional or mood changes? Zepbound may cause emotional changes in some patients, and the FDA label includes warnings to monitor for depression and suicidal thoughts, though clinical trials haven't established a definitive causal relationship. So, can Zepbound make you emotional? It's a question a lot of people have when they're thinking about starting this medication or already taking it. This matters because understanding all the potential effects of your medication helps you know what to watch for and when to reach out to your doctor. Let's start with what Zepbound actually is. It's an FDA-approved medication for chronic weight management that's used under medical supervision. It works by mimicking natural hormones in your body that help reduce your appetite and make you feel fuller after eating. The most common side effects are gastrointestinal, things like nausea, diarrhea, vomiting, and constipation. These usually happen when you're adjusting to the medication. But here's what you really want to know. Can it affect your mood or emotions? The short answer is that it may cause emotional changes in some patients. The FDA label for Zepbound includes warnings to monitor for depression and suicidal thoughts. That sounds serious, and it's important to be aware of. But here's the context. Clinical trials haven't established a definitive causal relationship between Zepbound and mood disorders. When researchers compared patients taking tirzepatide to those taking placebo, mood disorders weren't identified as significant safety signals. So why the warning? The FDA takes a cautious approach. They want healthcare providers and patients to be vigilant about mental health while using this medication. It's about being proactive and catching any potential issues early. Now, there's another layer to this. The relationship between weight loss medications and emotional well-being is complex. Sometimes the physical side effects can indirectly affect how you feel. If you're dealing with persistent nausea or fatigue, that can take a toll on your mood. Feeling physically unwell can make anyone feel down or irritable. It's not always a direct effect of the medication on your brain chemistry. Sometimes it's just the reality of not feeling great physically. Also, weight loss itself can be an emotional journey. Some people feel great as they see progress. Others might experience unexpected emotions as their body changes. Everyone's experience is different. If you have a history of depression or anxiety, this is something you should definitely discuss with your healthcare provider before starting Zepbound. They need to know your full medical history to help you make the best decision and to monitor you appropriately during treatment. So, what should you actually do with this information? If you're considering Zepbound, have an honest conversation with your doctor about your mental health history. If you're already taking it, pay attention to how you're feeling emotionally, not just physically. Keep track of your mood. If something feels off, don't brush it aside. Here's when you need to contact your healthcare provider immediately. If you experience thoughts of self-harm, that's urgent. If you're in immediate danger or thinking about harming yourself, call or text 988 in the United States or seek emergency help right away. If you're feeling persistent sadness that doesn't go away, reach out to your doctor. If you notice significant mood changes that are concerning to you or the people around you, call your healthcare provider. The FDA labeling recommends that healthcare providers consider discontinuing the medication if these symptoms occur. Your safety is the priority. And remember, do not stop or change your medication without speaking to your prescriber first. They need to guide any changes to your treatment plan. This isn't medical advice for your specific situation. Always consult with your healthcare provider about any concerns or questions you have about your treatment. Let's recap. Zepbound may cause emotional changes in some patients, and the FDA label includes warnings about monitoring for depression and suicidal thoughts. However, clinical trials haven't shown a clear causal link. If you have a history of mental health conditions, discuss this with your doctor before starting treatment, and contact your healthcare provider right away if you experience thoughts of self-harm or significant mood changes. If you're in crisis, call or text 988 or seek emergency care immediately. Have you had experiences with mood changes on weight loss medications? Share your thoughts in the comments. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.